Admit it. You do this every single day, maybe even right now, picking your nose, a habit you think is harmless. Stop. I am an ENT doctor, and I am going to show you what happens inside your nose when you stick your finger in there. After this, you will never do it again. See this area? This is Kieselbach Plexus. Dozens of tiny blood vessels are concentrated right here. They are thinner than a human hair, and they are right at the entrance, exactly where your finger goes. One careless movement, and a vessel ruptures. But the bleeding is the least of your problems. The real danger is what you bring inside.
On the tip of your finger lives Staphylococcus aureus, a golden staph bacteria. 30% of people carry it on their skin, harmless on the outside, but when you shove your finger into your nose, you deliver it straight into your mucous membrane, and your mucous membrane is an open gateway into your body. Infection from the nose can spread to your sinuses, that is sinusitis, from there to the eye socket, causing swelling and pus around the eye, and in the most severe cases, to the brain. Sounds like a horror movie? These are real cases from medical practice. Doctors call this zone the danger triangle. Seriously, the danger triangle of the face. Veins in this area have no valves. Infection from your finger can travel directly to the cavernous sinus of the brain. One abscess in the nose, and you are in intensive care. Even without infection, you physically damage your mucous membrane. Micro tears, dry crusts, chronic inflammation. Your nose constantly forms new crusts. You pick them off again, a vicious cycle, and the more you pick, the more you want to. A 1995 study in the Journal of Clinical Psychiatry found that 91% of people regularly pick their nose. It is normal. It is a reflex, but normal does not mean safe. The question is not whether you do it. The question is how to stop. Now I will give you 5 specific steps, not internet advice. This is what I recommend to my patients. It works. Step 1. Buy a simple saline nasal spray. Not a decongestant, saline only. Saline solution. 2 sprays in each nostril, morning and evening. This moisturizes the mucous membrane, softens crusts, and removes the very reason you pick your nose. No crusts, no urge to pick. Step 2. A humidifier in your bedroom. In winter, indoor humidity drops to 20%. Your mucous membrane dries out, cracks, forms crusts. You wake up, and the first thing you do is pick your nose. Optimal humidity is 40 to 60%. One humidifier solves half the problem. Step 3. Nasal irrigation. Neti pot or nasal rinse device. Warm water with salt. You rinse each nostril. This flushes out dust, allergens, dried mucus, everything you normally dig out with your finger, without the damage. Do it every evening before bed. Step 4. A thin layer of petroleum jelly inside each nostril before bed. This creates a barrier. The mucous membrane does not dry out, crusts do not form. In the morning, your nose is clean, moist, healthy, zero urge to pick. Every ENT doctor gives this advice, but almost no one knows about it. Step 5. If nose picking is a nervous habit, like nail biting, you need a replacement. A fidget ring, a rubber band on your wrist, a stress ball. The point is to keep your hands busy with something else. This is a cognitive behavioral therapy technique. Sounds simple, but within 3 to 4 weeks, the habit breaks. Let us recap. Saline spray, humidifier, nasal rinse, petroleum jelly. Replace the habit, 5 steps, and your nose is safe. But do you know what is worse than picking your nose? There is one thing that millions of people do every single day. It causes more damage than your finger, and most people do not even suspect it. What is it? I will tell you in the next video. Subscribe, hit the bell, and you will be the first to know. Dr. Pshik, take care of your nose.